I'm Jeremy Winn, licensed clinical social worker, and today I'd like to talk a little bit about mental health diagnosing and my perspective on its relationship to therapy and how it informs my practice. So one of the reasons why I thought I'd address this topic today is because it's very common when people look into getting into therapy that they want to find out what's wrong with them. They're curious if they're crazy or not. More times than not, when people are considering getting into therapy, they've exhausted a lot of other options and they still haven't gotten the resolution or the answers to the issues or problems they've been faced with. And in my experience, when people get to that place where their normal way of handling or resolving things doesn't work, they start to think that something's wrong with them. They often ask the question, I'm crazy, especially when it relates to the realm of mental health and mental illness. So usually when somebody has come to terms with, yeah, I'm going to go get some therapy or I'm going to go get some help in mental health, they often want to know, well, what is my diagnosis? So here we have in my hand, it matches my shirt. It's pretty cool. This is the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, commonly known as the DSM-V. This is published by the American Psychiatric Association and is commonly used in mental health clinics, hospitals, anybody that's using mental health diagnoses. I think the first DSM came out sometime in the early 1950s. There's also the International Classification of Disease. I think they're on their 11th edition. It's commonly referred to as the ICD-11. It's published or put out by the World Health Organization. In these manuals you'll find all sorts of mental health diagnoses, from your childhood disorders like attention deficit hyperactive disorder, or commonly referred to as ADHD, and oppositional defiant disorder, to your psychotic disorders, your depressive disorders, your anxiety disorders, your bipolar disorders, your trauma disorders, and even your personality disorders like borderline personality disorder, histrionic personality disorder, and narcissistic personality disorders. All these and their derivatives can be found in this manual. And usually to be diagnosed with one of these mental health disorders, you have to meet a certain number of criteria. The criteria usually relates to your mood and emotions, your thought processes, and your behavior. If you've ever read through one of these manuals or looked up in a mental health diagnosis, after reading the criteria, you may have thought, oh, I have all of these things. And truth be told, many of the symptoms or criteria that qualify somebody for a mental health diagnosis, we've all experienced. I remember when I was first in grad school and I took my first mental health diagnostic class, I was like, oh my gosh, after every disorder I studied, I was like, man, I have this, I have that. But the important thing to remember what will qualify you for one of these diagnoses is that usually there's very specific guidelines about the onset, frequency, duration, and intensity of the symptoms that are listed in the criteria. Also, the criteria in these mental health diagnoses have to be causing significant distress or impairment in your daily functioning, usually in occupational and social impairments. So you're having a hard time studying, going to school, getting a job, working, having a hard time getting along with others. It's having a real negative impact on your interpersonal relationships and things like that. So when you start to take that stuff into consideration, you start to give yourself a little bit of a break and not think that you have every diagnosis in these big diagnostic statistical manuals. When you go see a therapist or a mental health worker, they'll usually formulate a provisional or working diagnosis. In the beginning, a lot of the diagnosis is based upon the questions asked by the therapist or mental health worker. Over time, through working with the individual, they may update the diagnosis through their observations or things reported throughout treatment. Sometimes people will go get additional psychological testing to get more specific information about their diagnoses. They'll go through a battery of psychological tests that oftentimes can give a more in-depth description of their mental health impairments, their mental health diagnoses. Now, I'm not here to go through the whole DSM-V and talk about every diagnosis and what the criteria is. There's lots of literature out there, lots of trainings and things that you can look into for that. So some of the things that I really like about mental health diagnosing is that I think it's really helped to legitimize, if not at least professionalize, the behavioral and mental health sciences. Mental health diagnoses is also used by insurance providers for reimbursement in today's managed care system. So if you have insurance and you're using insurance to help pay for your therapy for reimbursement purposes, the therapist will have to provide the insurance company with a qualified diagnosis. It's also helpful for doctors or psychiatrists when prescribing medication, when you're dealing with the neurobiology or the neurotransmitters and chemicals in a person's brain through pharmacology and medication. Having an accurate diagnosis can be really important. So even though I'm not a doctor, I understand that it's very important for psychiatry to have a good understanding of what their mental health diagnosing is, because it's really going to inform what medication medication they will or will not prescribe. It's also just a way in general for therapists and mental health workers to communicate with one another about patients, whether they're doing a presentation or a consultation. Instead of having to describe every problem and symptom and criteria that the individual is experiencing, they can use a diagnosis and at least will give a general idea to the other people that they're consulting or talking to about the individual or case. And for me, I think the most helpful reason for diagnosis is it can really help an individual who's been struggling or has been having difficulty get some clarity and some understanding about maybe what's going on with them. And that can be a very powerful thing, especially in the beginning stages of treatment. But for me, when I see somebody for the first time or in the beginning phases of treatment and they come with a presenting problem, whether that person has a diagnosis of anxiety or depression or any other type of mental health diagnosis, it's not going to have a drastic impact on how I approach the therapy. I'm still going to start with where the individual is at, what is their presenting problem, what brought them in to my office, what motivated them to seek treatment. And usually what they bring in is having a negative impact in some area of their life. And so the goal in the therapy will be able to decrease those unwanted symptoms and negative impacts or impairments on their daily life. For me, I don't want to get too caught up on a diagnosis because then there might be this generic cookie cutter feel to the treatment. And I really want the treatment to be personalized, because you could put 100 people in front of me that all meet criteria for major depressive disorder, but their perception of what is going on with them or the nuances of how they experience those symptoms there could be totally different. And so therefore, all those cases, treatment could be drastically different or experience in therapy could be drastically different. But if I just think, oh, they all have major depressive disorder, this is step A, step B, step C into providing treatment, there might be a lot of stuff that I'm going to miss. For me, when it comes to a person's mental health, I like to think of symptoms and a person's psychology on a spectrum. Is the person that's coming into treatment, are they in a regressed psychological state or an underdeveloped psychological state, or is it relatively healthy and there just needs to be some tweaks here and there? And that will have a much bigger impact on how I relate to them in the session. It also helps me to remember that a person's mental health isn't a linear progression, that you get to point A, to then to point B, and then to point C, and there's no backsliding. Unfortunately, that's just not how it goes. Sometimes when people do finally seek out treatment, they may be in a much worse place than they were earlier on in their life and are trying to get back to where they were. Or maybe somebody has never really gotten to a good space with their mental health. So without being stuck on a diagnosis, I hope to provide the insight and understanding that can help somebody gain a better awareness and trust to work through whatever it is that they brought into the therapy room and to ultimately have a positive impact on the person's psychology and overall mental health. So don't get so hung up on what's wrong with you and what is your diagnosis, and don't be afraid to give therapy a try.